All right, thank you all for joining us. Sending a warm welcome to everyone here with us today. Welcome to the May webinar for the Domestic Family and Sexual Violence DFSV Data Insights Network for 2025. I'm Nadia, the Research and Data Officer, and I work in the Research and Policy team at QCOSS, the Queensland Council of Social Service. I work with Amy, the Senior Data Analyst and Project Lead for this initiative, and I'm supporting her today to coordinate and facilitate this webinar for the DFSV Data Insights. Today marks the start of National Reconciliation Week. QCOSS acknowledges the historical injustice of colonisation and dispossession on First Nations people and its ongoing impact and legacies. We are committed to reconciliation, self-determination, and opportunity for First Nations peoples as integral steps in achieving equality, opportunity, and well-being for all Queenslanders. I am joining you from Meanjin, Brisbane, and respectfully acknowledge the Yagara and Turrbal people and all First Nations colleagues and friends joining us online today. As way of introduction, we'd encourage you all to share, if you feel comfortable in doing so, in the chat, who you are, where you work, and to acknowledge country where you are today. So the purpose of the webinar today is to learn how to find quality information, navigate freely available data sources, integrate your findings to support work across DFSV prevention, early intervention, crisis recovery, and recovery. Today's session is for 1 hour. I'll spend 10 minutes for the introduction and welcome. We have 40 minutes for the guest speaker data presentation by Amy, including a special guest from YFS who has kindly offered to join us today to speak about the value of this data from a community service perspective. There will be 5 minutes for discussion and Q&A, and we have a 5-minute wrap-up and polling at the end. A couple of things to note. By default, you will be on mute, but your camera will be turned on. This session will be recorded. If you don't want your face showing in the recording, please feel free to turn your camera off. The QA component of the webinar will not be recorded. If during Q&A you would like to ask a question, you can write the question in the chat. The other option is you could put your hand up using the raise your hand emoji and then take yourself off mute to ask the question. If we run out of time with the Q&A, we can connect with you individually after the session. Please include any questions you have in the chat pane. So, QCOSS, the Queensland Council of Social Service, is Queensland's peak body for the social service sector. Our vision is to achieve equality, opportunity, and well-being for all Queenslanders. QCOSS is also the state interim DFV peak body for domestic and family violence sector. For inquiries related to the DFV peak, please contact dfvpeak@qcos.org.au. The DFSV Data Insights Initiative and the network is funded separately to the DFV peak. The Queensland Government has funded QCOSS to deliver activities that aim to build and strengthen the data capability of DFSV services staff and DFSV organisations and internally within the department. This initiative also extends to sexual violence services. QCOSS acknowledges the impact of domestic, family, and sexual violence on individuals, families, and communities, and the strength and resilience of the children and adults who have and are still experiencing violence. We pay respects to those who did not survive and to their family members and friends. We acknowledge and celebrate the work, strength, and courage of the domestic, family, and sexual violence sector, the outcomes that they have already been achieved, and to all those who are part of the journey now. As a network, these discussions focus on domestic, family, and sexual violence. The presentation components of the session will be recorded, so if you need to step away, you're more than welcome to come back and watch the session at a later time. If you do find yourself in need of support, please reach out to your EAP, supervisor, or support services, such as the ones we have listed on the slides. A reminder of the guiding values of the network: collaboration, transparency, safe place to ask difficult questions, confidentiality, peer support, and innovation. So firstly, a quick recap on the DFSV Data Insights Network. The purpose of the DFSV Data Insights Network is to improve the data maturity of the DFSV service sector to ensure that there is an understanding of and commitment to the benefits of adopting an insights-driven approach. To ensure sector uptake of resources and provide support across the DFSV service sector to enable service responses that are underpinned by integration, robust information, and evidence-based practice, and to enable the DFSV service sector to be positioned to enact people, process, and system changes as required through business readiness and data strategy support. The DFSV Data Insights Network provides an opportunity for collaboration and knowledge sharing in the area of DFSV data, with the aim of more effectively utilizing community sector resources and products developed by the department to promote improved outcomes and data capability across the DFSV service system. Over the webinar series, you can learn more about the value of data, data strategy, data governance, data quality, data maturity, measuring impacts and outcomes, data visualization, and system standards and good documentation practice. So we also have a quick overview of the DFSV Data Insights resources that are available for this initiative. We have the DFSV Data Insights website page where you can find out more about the DFSV Insights initiative, express your interest to join the network, as well as links to access data supports and resources. In addition to the network, QCOSS is funded to provide additional uplift data capability supports for up to 20 DFSV funded services. So please reach out to our team if you would like to request support for your organization. You can do this through the link on the website. We'll share the links to the website along with other resources in the chat pane for you now. We also have the DFSV Data Insights Community Door Resources hub page where you can watch previous webinar recordings and access resources for the DFSV Insights initiatives as they become available. You can read our guide for managers to speak about the DFSV Data Insights initiative and share it with your teams, which can be you can access that resource on the community door page as well. We also have approval to share 2 draft documents for the purpose of information sharing and further feedback, education and training. There is a draft DFSV Service Sector Data Governance Framework and a draft DFSV Service Sector Data Quality Strategy. These documents will be the focus for the DFSV Data Insights Network future webinars. We would also welcome the opportunity to receive any feedback from the sector about the draft documents and invite you to connect with our team to discuss these resources further. In terms of the journey so far, QCOSS has coordinated and facilitated 4 network webinars, and the details of these webinars can be accessed in the slides, which will be shared in the post-event email. For those of you who may have missed previous webinars, we'll share the links to the recordings in the chat now. And in terms of the plan for the network going forward, this slide maps out the next webinar topics under consideration and development. Today we're hosting the 5th webinar for the network on supporting Queensland's DFSV sector with open and administrative data. We're currently also in planning mode for the next 3 webinars on data governance and data quality in June, measuring impacts and outcomes in July, and domestic and family violence death reviews data in August. We hope that provides a good grounding for where we are with the network and activities. We'll move on now to the guest speaker components for today's webinar, supporting Queensland's DFSV sector with open and administrative data. First, we'll hear from Amy, who is the Senior Data Analyst in the QCOSS Research and Policy team. Her role involves providing meaningful analysis and advice that supports the development of evidence-based decision-making and reporting specific to the community service sector. She provides high-quality advice on the use of data and information to improve outcomes and access to services for vulnerable and at-risk populations in Queensland. At QCOSS, Amy provides secretariat support to the DFSV Data Insights Network, established the long-standing research and evaluation network, facilitates the production of reports and delivers practical advice on the availability and appropriateness of data sources. Amy has over a decade of experience in data analytics, working in government and non-government sectors. Her technical research and writing skills have covered an extensive range of areas including health, child safety, housing, aged care, disability, education, domestic and family violence, employment, crime, justice, and demographics. We also have Katie, who is the Evaluation, Implementation and Innovation Manager at YFS in Logan. Over the past 8 years, Katie has led the establishment of the organization's outcome measurement approach and developed their monitoring, evaluation, and learning framework. This work has enabled YSS to build its evidence-based, improve services, and demonstrate impact. She has a background in monitoring and evaluation, research, and organizational development. Katie has kindly agreed to come along today to share some insights from the sector on the value of open data to their organization. We've also previously had the opportunity to deliver a webinar with Katie, so we will share the link to that recording of the webinar in the chat now. I will now hand over to Amy and stop sharing my screen.
Thank you so much, Nadia. I'll just try and share my screen now. You see that okay?
Yes.
Excellent. Okay, wonderful. Well, hi everyone. Really lovely to be here as a speaker today rather than a facilitator. So this is something not that I usually do. Again, my name is Amy. I'm the Senior Data Analyst in the Research and Policy team at QCOSS. So what I'm going to share today with you is really a snapshot in time over our journey with working with data more broadly as a peak body for the community services sector, and then more recent work collating open and publicly available data with a focus on domestic and family and sexual violence. So I too am joining you from Meanjin in Brisbane on the banks of the beautiful Maiwar Brisbane River, and respectfully acknowledge the traditional custodians where I'm joining you from today, the Yagara and Turrbal people. In addition to National Reconciliation Week, I also wanted to acknowledge the overrepresentation of First Nations, young people and families in care, in justice systems, and in fact across most of the systems that the sector works across. So for victim survivors as well, First Nations people are overrepresented in the statistics. At QCOSS, we monitor and collate a range of data indicators to support our understanding of community need and use this to ensure we have a strong evidence base. We also gather and share data to support the sector to access quality and reliable data. So to support the sector in terms of access and making meaning of data, we've developed a number of available data resources and tools, including QCOSS Data Point and our community data profiles. So today I'm going to cover QCOSS Data Point, our community data profiles, and also some examples of DFSV data sets that we collate. So the slides and the data profiles that we're presenting today are available on our website on the QCOSS Data Hub and can be openly accessed after this presentation as well. So I'll present an overview of some of the types of data that we collect and visualize, highlighting key insights, and some of this data is available and shared at the state level, and some data we've collated at the local government area, SA4 or SA3 regional or area level. So we hope it may assist to inform the evidence base that's needed for policy planning and research purposes, as well as for specific purposes such as grant writing. And the presentation today links to the DFSV Data Insights Initiative through increased data capability for the DFSV service sector. So for example, data is used to understand and identify workforce need and demand and enable better coordination across the DFSV service system. And more broadly, services and systems data capabilities are established and are well placed to support a deeper understanding of the complexities and needs of service system users and demand on the service systems. So in terms of context measures, the data that we collate, which are also included in our community data profiles, which I'll go through shortly, provide an overview of selected indicators that align with the QCOSS policy focus areas. And so these include housing and homelessness, youth justice, living affordability, women's equality, and children and young people. We also collect data about the community services sector more broadly, including demographics and workforce data. So today we'll also look at specific examples of domestic, family and sexual violence data sets, including info exchange community services directory searches, which highlight family violence searches. We're looking at Queensland courts, specifically magistrates data. So in terms of DVO applications, contravened DVO charges lodged and flagged DFV offences, as well as strangulation offences. We're also going to look at QPS, or the Queensland Police Service, reported offences, offenders and victims, including breach of domestic violence protection order offences. Also looking at domestic and family violence hospitalisations and specialist homelessness services and clients experiencing or reported experiencing domestic and family violence in that data set. Lastly, I'll touch on victims of sexual assault data set as well. Before we review the data, I just really wanted to flag the sensitive nature of this data and information, and some of the content can be distressing and confronting. So it's really important to acknowledge and recognise that people and families and communities with lived experience are represented in these statistics. We'd also like to acknowledge and celebrate the strength and courage of the DFSV service sector and the services you provide to community that work towards prevention, early intervention, crisis response and recovery to address and solve some of these really complex issues. In addition, community voices and perspectives and interpretation and context of this data is so important. So the on-the-ground knowledge and insights and stories of communities add so much value to the understanding of these data, or potentially also an opportunity to challenge and question some of this data as well. So in the brief, we said that we apply a systems lens in our work, and this applies across our data and policy work as well. So you may have already seen this data. However, it is important to think about the impact of domestic, family and sexual violence across some of the systems that you may work within or interact with, as well as the experiences of victims, survivors and the impact of these systems. So for youth justice, for example, 53% of young people coming into contact with the youth justice system have experienced or been impacted by domestic and family violence. For children in care, 11% had experienced sexual abuse pre-care, 46% had experienced physical abuse, 83% had experienced emotional abuse, 88% experienced neglect, 68% had an exposure to domestic violence, and 69% experienced 3 or more abuse types. So this is really a snapshot of data. Of course, it's not comprehensive, and there are many other complexities across systems and lived experiences to consider. We could also look at data across health and housing and homelessness and employment services to consider additional intersectionality. And if we looked at linked data across systems, that would also provide some additional data insights to learn and discover as well, which we haven't included in the presentation today. So as I mentioned, QCOSS have developed a number of available data resources and tools, including QCOSS Data Point and our data profiles. QCOSS Data Point is a central location where community service staff and DFSV service staff can access up-to-date data that's relevant and meaningful to the sector. Key data sources, data visualizations, and data tools have been selected that are user-friendly and also publicly available to support the data capability and use of data in the sector. Data Point is intuitive and user-friendly. Data sets are categorized across QCOSS policy focus areas, which I mentioned previously. So you can filter your searches by search by category filter on the left-hand side and select the policy area of interest, or you can also filter your searches by using the search by agency filter and select the relevant agency or data custodian of interest. And then you can also filter your search by using the plain search text function and enter a keyword. And clicking on the link will take you directly to the data source to explore further. So data sets related to domestic family and sexual violence will mostly appear across and under the search category of women's equality, although there may be tagged under other categories as well where relevant to the data set. So for example, for specialist homelessness services, data collection will be listed under housing and homelessness category, but it's also included in the data relating to specialist homelessness service clients experiencing domestic family violence. And so it may be listed under women's equality there too. If you are a QR code fan, you can also access Data Point through our QR code. So we do try and keep the data up to date on the QCOSS Data Point. However, if your organisation finds data that's useful that we haven't already included, please flag that with us at research@qcoss.org.au. So QCOSS collects, collates and analyses data related to the sector from various sources to create the community data profiles. You can access these on our data hub, which I've mentioned, and we'll share that link in the chat. Thanks, Nadia. And the data profiles provide an overview of selected indicators that again align with our policy areas. The data relates to communities involved in the QCOSS Town Hall events held throughout April and June this year. So it includes Rockhampton, Moreton Bay, Toowoomba, Logan, Cairns, Mackay, Mount Isa, Townsville, Brisbane, Gympie, and also Gladstone. Data is presented at a local level where possible, depending on data availability and access. So the profiles should be used to complement existing additional data sets identified by organisations at the local level, in addition to organisational data assets that organisations themselves collect and analyse. So in terms of access to the information, please again contact our team if you can't access the data that you're looking for. We do provide access up to date over time, or alternatively, you can access new data directly from the data source referenced in the profiles themselves. So in terms of context measures, moving on to looking at some of the measures that we collect and analyse. Firstly, we have some key figures relating to demographics of the region, in this case Queensland. So there's an estimated 5,583,000 people living in Queensland, projected to reach 7,299,900 people over the next 25 years. The median age of Queenslanders is 38.5. The percentage of persons aged 65 years and over is 17%. First Nations persons make up 4.6% of the Queensland population, and 22% of Queenslanders were born overseas. In terms of economic indicators, include income levels, household income, as well as unemployment rates. So Queensland has a median personal income of $787 per week and an unemployment rate of 4.8%. at 4%. So we've highlighted these statistics as risk factors for the experience and or use of violence can include employment or losing, including job loss, and financial or personal stress, including poverty, as well as housing insecurity. Some other statistics on this page, the median house price is around 699,000 and the annual dwelling approval growth in Queensland is 8.7% for growth on previous year ending at the time that this data was collated, which was the 14th of April. So if you're interested in your own community's data profile, again, you can access this information in our data profiles or head to the Queensland Government Statistician's Office regional profile snapshot, and you can find this information that's up to date as well. So the data here are requests for assistance depending on the types of services people need. So searches for assistance can include family violence searches, but also includes a range of other search categories as well. So we access this data. This is one of the only data sets that isn't publicly available that we access and analyze through a data partnership agreement. So info exchange service directory searches are based on where a search or where a service is located that a user is wanting to access. So this data can be interpreted as a proxy to measure the level or intensity of demand for services. Total info exchange service directory searches have more than doubled for Queensland from 28,189 searches in August 2020 to 58,911 searches in March 2025, with the highest number of searches across the Logan-Bow Desert region, followed by Gold Coast. So in terms of the search categories, food was the most popular search category in March 2025, accounting for 28% of all Queensland searches, and this was followed by housing at 21%, financial assistance at 17%, mental health at 10%, and family violence making up 7% of all searches for assistance. So this slide shows the number of searches by category and the increase over the last 12 months. The table is sorted by count number with the little arrow that you can see there, and also the chart is sorted by percentage change over the 12 months, and you can see the chart on the right hand side significantly weighted from the disasters category, and that will be reflecting the impact of ex-cyclone. So I guess important to note as well, in times of stress, including health, economic and natural disasters, that may increase the likelihood of violence occurring. So the March 2025 data may also reflect this experience. If we focus on the left-hand side, we can see the change across housing searches increased from 10,180 to 12,107, representing a 19% increase. Financial searches for assistance increased by 16%, and then family violence searches increased from 3,160 in March 2024 to 4,287 in March 2025, representing a 36% increase. Over the time series, family violence searches have more than doubled in this data set. So from 1,834 searches in Queensland in August 2020 to 4,287 searches in March 2025. Access to affordable, safe and secure housing for women and children escaping violence has been recognised as a factor that may help reduce family and domestic violence. So women facing homelessness can experience compounding factors of social exclusion and also disadvantage. So we collate the social housing register data to better understand social housing need and demand. In Queensland, there are over 25,000 families and almost 46,000 individuals on the social housing register. We also analyse this data by local government area in the community data profiles, both annually and also by quarterly data now available. You can also access the annual dashboards on our website on the Data Hub as well. So this first slide is the annual data. For Queensland, the number of applications has increased from 15,657 in 2017 to 25,234 in 2024, and that's representing a 61% increase in applications. The average number of months on the wait list has increased from 15.5 months in 2017 to 27.1 months. 52% of applications on the social housing register were flagged as people experiencing homelessness or at risk of homelessness. 33% of applications were for households including children. 61% of applications were for single-person households, and 29% of applications were single-parent family households. And lastly, 46% were applications for households including persons with a disability. This slide includes the quarterly data. So the number of applications on the social housing register has increased by 10% over the last quarter, from 25,223 in quarter 2 to 27,668 in quarter 4 of 2024, representing a 9% increase, or almost 4,000 persons increase over the last 6 months of the data set. If we link back to the earlier slide about systems and youth justice statistics, 53% of justice-involved young people have experienced or been impacted by domestic and family violence. Women who have been incarcerated are also more likely to experience violence after they are released and are more likely to return to prison. That data is referenced from Anne Rose in 2020 and sourced from the AIHW. So the data included here is from the AIHW as well, reviewing young people in detention, which is measured by young people in detention on an average night. So these data are available by age group and sex and First Nation status at a state level. No regional data, open data are available that we know of at this stage. So this chart is by quarter and year and shows Queensland as having the highest number of young people in detention on an average night, and this has been increasing since September 2020. On an average night, there are 317 young people in detention in Queensland. Of these, there are more males than females, 281 compared to 36. Queensland also has the 4th highest proportion of children aged 10 to 13 years in detention, with 4.7% of children in detention aged 10 to 13 years. Northern Territory, WA and the ACT are higher at 14.7%, 9.3% and 6.7% respectively. If you look at absolute numbers, Queensland overall has the highest number of children aged 10 to 13 in detention, with 15 children in detention on an average night. This is also almost double the amount of children in any other state or territory. This next slide shows this data again, but gives a breakdown for First Nations communities across Queensland, or in Queensland, sorry. So on an average night, there are 227 First Nations children in detention in Queensland, 12 of which are aged 10 to 13 years. So First Nations children are significantly overrepresented in these data and make up the majority of children in detention at 71%. So in terms of child protection data, misidentification of victim survivors as perpetrators can lead to incarceration and also interaction with the child protection system. That's referenced by Snake in 2024. The next data source is accessed through the Department of Family, Seniors, Disability Services and Child Safety Open Data, and the links to the data sets Nadia is sharing in the chat, so you can explore those dashboards yourself in your own time. When we're looking at child protection statistics, it's important to recognise, again, the overrepresentation of First Nations children in the child protection system, and this slide reflects this overrepresentation at the state level in Queensland. You can see 47% of all children in care are Aboriginal and Torres Strait Islander children, and this has increased since June 2018 from 42%. 26% of all children subject to an intake are First Nations children, 31% of children notified are First Nations children, and 36% of children substantiated are First Nations as well. So we also visualize this data across regions. So these next data are based on government-defined child protection regions. So they're a lot larger geography than a local government area. And looking at the children receiving ongoing support, for example, as well as intervention with parental agreement and child protection orders. So these are just some of the examples of the data that we collect and visualize. I might skip over a few of these slides just for time purposes. So this one is intakes received by the region, including child reports and notifications. For intakes, this is defined as all concerns received by the department about harm or risk of harm to a child, and intakes received is the total sum of child concern reports and notifications. We can also look at this data over the time series for intakes received by the region, child concern reports and notifications, for example. So this time series is looking at the southeast region, and you see that there has been an increase across all three of those measures in the last one or two financial years. Logan, for example, is included in the southeast region. These are visualizations based on substantiations, again, across the regions, as well as also children living away from home in home-based care. We've also visualized family support services, which looks at family and child connect inquiries received, families receiving a family wellbeing service, and families receiving an intensive family support service across the child protection regions. These next figures are estimates of weekly cash earnings, and the data is from the ABS captured through a biannual survey. So for the last data, which is November 2024, the weekly cash earnings gender pay gap was 9.4%, which you can see for Queensland here on this slide. So moving on to specific examples of domestic and family and sexual violence data sets, we're going to look at the Queensland Courts domestic and family violence statistics for Queensland over the last 5 years. So we've visualized this data by location in relation to magistrates' courts, and the magistrates' courts included in our community data profiles are the ones with the most lodgements and publicly available data again. So for Queensland in 23 to 24, there were 40,471 contravened DVO charges lodged, 16,063 flagged DFV offences lodged, and 1,186 strangulation offences lodged. Over the time series, you can see there's been an increase in these DFV court statistics, apart from the decrease in strangulation offences over the last financial year. As at March 2025, there was an increase of 3% more contravened DVO charges lodged, an increase of 8.3% more flagged DFV offences lodged, and an increase of 13.5% of strangulations offences lodged as well. So in our community data profiles, we also include the DVO applications, initiating applications only for each of the regions we collate for the profiles. In terms of the next 4 slides, they visualize the same data but by location. So in terms of DVO applications, year-to-date percentage changes have seen the highest increases across Caloundra as well as Richlands, Brisbane and Caboolture, and the highest percentage decreases were experienced in Gladstone and in Redcliffe. In terms of contravened DVO charges lodged, year-to-date percentage changes have seen the highest increases across Cleveland, Rockhampton, Townsville and Caboolture, and highest percentage decreases were experienced in Mareeba and Caloundra. In terms of flagged DFV offences, percentage year-to-date changes have seen increases in Caboolture, Rockhampton and Richlands, and highest percentage decreases experienced across Mareeba and Doomadgee. And lastly, in terms of strangulation offences, so risk factors associated with a higher likelihood of violence reoccurring or resulting in serious injury or death include non-lethal strangulation. So in terms of strangulation offences lodged, in terms of percentage year-to-date changes, the highest increases have been seen across Townsville and Rockhampton, and the highest percentage decreases were experienced in Toowoomba and Southport. Moving on to QPS or Queensland Police Statistics offence data. So data are collated for reported offences, offenders and victims, and the offence data is based on the Australian Standard Offence Classification. So offences are often categorised into one of 3 categories, which are offences against the person, offences against property and other offences. So for Queensland reported offences for the month of March 2025, there were 7,455 reported offences against the person, 21,992 reported property offences and 20,654 other offences, which makes a combined total of 50,101 total offences. If you're looking for continuously updated and visualized data on this, the QPS offences information is also visualized on a website, which Nadia will share in the chat. We also have reviewed breaches of domestic violence protection orders in this data set. So a breach of DVPO is included and categorised under other offences. So for March 2025, there were 6,048 offence counts of breaches of domestic violence protection orders, or a rate of 105.4 per 100,000 persons. This data is made available over a time series dating back to July 1997, so over 27 years of data. The increase over the last 10 years is evident in the charts. If we look at the same time period covered over in the earlier slide, from July 2018 to February 2025, domestic violence protection order offences have more than doubled from a rate of 43.5 per 100,000 persons to a rate of 105.4 per 100,000 persons. This data is also available by local government area. The chart on the left is sorted by the rate per 100,000 persons, and then the table on the right is sorted based on count. So for March 2025, highest counts for breaches of domestic violence protection order offences were across Brisbane, Logan, Moreton Bay, followed by Townsville and Gold Coast. In terms of highest rates, they were recorded for Mornington Shire, Warrabinda Shire and Lockhart River. And just, I guess, to keep in mind that some of these communities are really small in size and counts, and so the rates can really fluctuate from month to month. So this is just one snapshot in time from March 2025. In terms of reported offenders for Queensland for March 2025, there were 24,750 reported offenders. Again, this data is available by region. So if you're interested in your own community's data, I'd encourage you to access the community data profiles or access the raw data online or reach out to QCOSS. Reported youth offenders accounted for 19% of offences against the person, 27% of offences against property, and 5% of other offences. And this slide visualises that information for young offenders by total counts for Queensland. In terms of victims, trends show that victim counts are increasing. So of the 7,257 victims in March 2025, 4,413 were female, or 61%. So this was an increase from 1,319 victims for July 2018, representing a 235% increase in female victims over the time series. The next data is from the National Hospital Morbidity Database, which again is through the AIHW. We have visualized total assault separations, which are actually episodes of care. And so this is by state, socioeconomic area, and also remoteness area for 2022 to 23. And it's from the National Hospital Morbidity Database. So Queensland has the highest number of total assault separations or episodes of care by state at 1,716, and the third highest in terms of the rate of total assault separations following Northern Territory and WA. For the most disadvantaged socioeconomic areas, the higher counts and rates for total assaults. And this is also true for remoteness area, where very remote and remote areas have much higher rates of total assault separations per 100,000 persons than outer or inner regional areas and also major cities. But in terms of total assault separations and the counts, major cities have the higher counts. The next data set we're going to look at is the AIHW Specialist Homelessness Services collection data cubes with the data based on the 2023 to 24 financial year. This shows a comparison across regions on the proportion of specialist homelessness services clients counted as experiencing domestic and family violence. And so this is counted to include if in any support period and the reporting period, the client was formally referred from a non-SHS FDV agency to an SHS agency, or the client reported domestic or family violence as a reason for seeking assistance, or the agency worker identified a need for assistance for domestic or family violence. So you can see for Queensland, Queensland Outback has the higher proportion of SHS clients experiencing domestic family violence at 42.7%, whereas Mackay, Isaac, Whitsunday region has the smallest proportion with 22.9%. When we look at this information, we can compare within regions too. So this is an example for a statistical area 4 area, and that's Logan Road Desert. And so it has one of the highest proportions of SHS clients experiencing domestic family violence at 38.1%. And the number of specialist homelessness clients counted as experiencing domestic family violence is here as well. It's 1,247. We can also review the people accessing specialist homelessness services by sex at a SA3 level area, so a smaller area level. For example, women and men accessing SHS services in Springwood and Kingston are 1,243 compared to Bow Desert, which has 44 people accessing SHS services. So the domestic family violence data isn't available by age or sex at a SA3 or SA4 level area, so we can only really look at this information for overall access to specialist homelessness services. But in terms of the SHS clients experiencing DFV, Bow Desert SA3 has a much higher proportion of clients experiencing domestic family violence at 56.8% compared to Logan Lee, Carbrook at 33.8%. So I just wanted to pause there. I know we've gone for a really long time. That's a lot of data to cover. I wanted to introduce Katie from YFS to speak to the value of this data for Logan and across YFS. So I will now hand it over to Katie. Thank you for joining us, Katie.
Thanks, Amy. That was super insightful to get a sense of what data's out there and what it's looking like at the moment. I'm keen to dig in a little bit deeper into that data myself. I just wanted to introduce myself and talk a little bit about YFS and how we use some of this data in our work. So my name's Katie. I'm the evaluation manager at YFS. We're based in Logan and the Scenic Rim, and we provide a range of different services, including domestic and family violence services, specialist homelessness services, and a range of other youth and family services. And so some of the ways that we use this data, I might just ask if you flick over to the next slide, thanks, is to really help us understand the big picture and the context in which we're working, in particular understanding the prevalence of particular issues such as domestic and family violence at that kind of population level, and some trends over time, so we might understand how things are changing. Being able to drill down to the Logan specific level and compare across regions is incredibly helpful for us as well. I know a lot of kind of publicly available data at first glance doesn't necessarily go into that level of detail, and sometimes it's hard to kind of find it, and so we can get a sense of what things look like in general, but what does it look like for us here in Logan, and what's the picture here? We can also use that data to help sense check some of our own internal data or contextualize or complement it and see, are we seeing something, some trends in our data? Is that reflected in the broader data sets, and what does that look like? And I guess we can use that information in a number of different ways in terms of planning and designing our services, building the evidence base or business cases, and use it to advocate for resourcing or systems change. So particularly, I guess in terms of Logan, making sure that we're getting the right sort of share of resourcing for the size of the need and the demand that we are seeing in the community where we're working. And I thought I'd also share a really specific example of how we've used it recently, which is quite good timing. So about 2 weeks ago, Logan Zero hosted a forum which was around health exits from homelessness, exits from the healthcare system into homelessness. And so we were able to use this data set, the community profile that QCOSS had prepared, to really set the scene for that work for the day. And so you can see that in the top left there, some of the trends around homelessness and access to specialist homelessness services in Logan have really kind of shot up in the past year, which is definitely something that we're sort of experiencing on the ground, but it's nice to have that sort of anecdotal experience kind of confirmed by the larger sort of data sets, and having the additional context of other factors that might be going on in that space, such as the domestic and family violence. So yeah, it was really timely to have that data to be able to set the scene for that process, and being able to dig into the community level, I guess, beyond just the sort of state or national data. And I guess just in terms of a concluding thought, one of the things that I wanted to say is just the benefits of QCOSS kind of compiling and organizing all of this data for us and having it in the one space and doing some of those breakdowns really means that us as community organizations don't need to go hunting for it quite so hard as we might have had to in the past, but B, a lot of those breakdowns are already sort of done for us, so it's packaged up in a way that we can use and is meaningful. So yeah, thank you for that. That's just my 2 cents in terms of some of the ways in which we can use that data in the community space. So thank you very much for sharing today.
Thank you so much, Katie. I really appreciate you coming along. I know it was quite short notice in terms of inviting you along, so definitely appreciate your insights and really looking forward to hearing more about your work in the DFSV space as well as we continue along this journey for the network. We've just got a few more slides to go through if everyone's happy.
Amy, you've just muted yourself, or
Apologies. How long did I mute myself for?
right after we've just got a few more slides if everyone's happy to stay online.
I'm so sorry. Tech. Let me just try and my screen is and there we go. It minimized the window. Okay, so yeah, we'll just if everyone's happy to stay for 5 more minutes online, we'll just jump into the last few slides and hopefully we'll have time for a quick Q&A session after we stop recording. So I guess I just wanted to also then touch on the next data, which is the last data sets that we're looking at, which is around victims of sexual assault by location and year. So these data were accessed from the AIHW FDSV website and are based on ABS recorded crime victims RCV dataset. So for Queensland, you can see a marked difference and an increase in the number of sexual assault victims in the last 3 years. So from 5,120 victims in 2020 to 8,442 victims in 2023, an increase there in the percentage as well. The victimization rate has also increased over this time period from 98.9% per 100,000 persons to 154.6 per 100,000 persons. So this is a national breakdown of that same data set. So when you look at this by gender, you can see clearly there's a gendered dimension here with more women recorded as victims of sexual assault than men in 2023, but also across the whole time series. There were 33,466 female sexual assault victims with the victimization rate of 227.1 per 100,000 persons, and that victimization rate over the time series is increasing too. This is the same data again, but compares victims of sexual assault by state with counts on the left-hand side and victimization rates on the right. Along with Queensland, New South Wales and Tasmania have also experienced increases in the number and rates of sexual assault, particularly over the last 2 to 3 years there. Here we're looking at the time to report sexual assault by location and year. So for Queensland, 59% of victims reported a sexual assault within 1 year, 7% reported between 1 to less than 2 years, 11% reported within 2 years and less than 5 years, 10% reported between 5 years and less than 10 years, and 7% reported between 10 years and less than 20 years, and 6% reported 20 years or over. And so our footnotes do state that, caution should be used when comparing data across states and territories or different time periods due to differences between and changes to data collection practices between states and territories. But I thought it was interesting to note for Queensland, it was similar to Australia in terms of the proportions and time to report for less than 1 year at 59% and 58%. However, for Northern Territory and ACT and WA, they reported a higher proportions of time to report within less than the 1 year category at 76%, 77% and 73% respectively. So the next slide looks at the victim age at time of sexual assault incident. So for females in Queensland, the highest proportion of sexual assault incidents were across the 10 to 17 year age category at 29%, followed by 0 to 9 years at 23%, and 25 to 34 years at 16%. So the females data is down in the second table there. You can also review this information over the last 4 years in the time series. That's the end of my slides, so I'm going to hand it back to Nadia. I do apologise for going slightly over time, everyone.
Thank you, Amy, for presenting that data. So moving on to the last couple of slides now, QCOSS would love to hear from DFSV organisations that have or are working towards mature data systems, visualising their data, working with data related to First Nations communities or diverse groups, measuring impact and outcomes, examining their data governance processes, ensuring a focus on data quality or incorporating data into continuous quality improvement initiatives, have existing data collection systems, standards or documentations, and or are developing a data strategy or have an existing one in place. Please let us know if you're interested in becoming a future guest speaker for the network or if you think your organisation would make a great case study. We would love to hear from you. Just before we move into Q&A, we've put together a summary for DFSV services that may be unsure of how to get involved with the network. So you can join the network mailing list, request free one-on-one data support, express your interest to join the DFSV Data Insights Forum on Microsoft Teams, develop a case study with us about your data work, express your interest to be a guest speaker for the network, and lastly, email us at dfsvdatainsights@qcoss.org.au to find out more. We wanted to also highlight a national data project that's underway. The AIHW, with funding from DSS, is developing a pilot data collection on specialist crisis FDV services. They are seeking in-scope service outlets to participate in the 3-month pilot scheduled to begin in early 2026. In-scope outlets are government-funded specialist FDV services providing a crisis response to victim survivors of FDV, including central intake lines, crisis case coordination, crisis support, and crisis accommodation. The pilot will proceed in 2 phases, with separate First Nations approach operating on a separate time frame to current phase. The pilot is an opportunity to consider what data would be most meaningful to include in the future national data collection on specialist FDV services and how this can best be achieved. Funding is available for participating service outlets commiserating with social worker pay in the sector. The AIHW will work with service outlets to determine the most suitable arrangement based on the work required and available funding. On May 15, the AIHW hosted an information session for Queensland services with invitations sent to in-scope service outlets. If you are unable to attend this session or have any questions, please email AIHW's FDSV team at fdvpilot@aihw.gov.au. Again, please reach out to our team if you would like to share your data story with the network or if you have any questions about the DFSV network.